History laid the foundation
that informs our conversation. Welcome to the classroom.
From the church to the streets, and even in the suites, and all around the world. I'm gonna keep it real in the classroom.
Fannie Lou's classroom. Fannie Lou's classroom. Fannie Lou's classroom.
Good afternoon. We're so excited that you have joined us once again for Fannie Lou's Classroom. Listen, we are excited today about our guests and all we have going on today. So listen, like us on Facebook, subscribe on our YouTube channel, and also hit that notification button so you'll know when we go live, and share this with all of your friends, your family, and your colleagues. And so before we get started, we always want to give a major shout out to those who make this show happen and run smoothly. Please give a shout out and a good in the comment section. Say thank you to Roche, who is in the house. We want to thank Brooke, who is in the house. And of course, we have Superstar with us as well, who is part of the amazing engineering team here at Fannie Lou's Classroom. So listen, it's that time for our Fannie's Class segment. So today in Fannie's Class, we just want to talk about a subject matter that leads us to our amazing guest today in the topic. So this past last week on April 6th, President Obama returned to the White House for the first time since he left office to commemorate one of his mainstay or one of his signature pieces of legislation, the Affordable Health Care Act, which most people call the Obama Care. And we tried to use that language because it's been so politicized to talk about why we don't need to have affordable health care for all Americans. So we're going to talk about the Affordable Health Care Act and how that is supposedly how this opens up more accessibility and affordability for all Americans as it relates to health care. But nevertheless, we have to remember when it comes to health care in this nation, for Black folks, we have a special relationship that can be problematic and sometimes troubling when it comes to the healthcare system. We can think about, the syphilis study down in Tuskegee, the Tuskegee experiment. We can think about Henrietta Lacks, who had her cells taken from her and her family. Nobody knew about it, and has gone on to make major advancements in healthcare and science, but none of the family has benefited from using her cells. And even our very own Fannie Lou Hamer had a hysterectomy against her own wishes, against her own will, without her knowing. The ability to give birth to children was taken away from her without her consent. And so today we are super duper excited about the guest we have today, because she not only has worked within many healthcare systems, but she has also been a patient of healthcare systems. So we want to have a really robust conversation today. And so please, want to welcome Cheryl Prelow to Fannie Lou's Classroom. Let's give her a warm welcome and round of applause before I give you her amazing bio and resume. So Cheryl comes to us with the extensive experience in the healthcare field. For more than 25 years, she has worked in many high-level roles in the healthcare system. She's worked at Prism Health North Texas, Dallas County Medical Society, Texas Health Resources, Health Midwest Medical Group, Samuel U. Rodgers Community Health Center, Detroit Medical Center, Trauma Medical Care. Listen, she has done quite a bit. In her last role as the Chief Operations Officer of Prism Health North Texas, Cheryl fulfilled a critical role in executive leadership for this nonprofit organization that provides health care to individuals living with HIV and AIDS in North Texas, which we know is very important as it relates to the African-American community, particularly Black women. So we definitely thank her for her work with that. And also she directed all facets of operations, including business development, work plan development, oversight of project teams engaged in initiatives across IT, human resources, quality improvement, research, compliance, and clinical operations and program administration. So y'all, we have a heavy hitter today. But what we want to talk to Cheryl about on today is going to be really around, and let me mention this, because she not only has worked within, been a patient of, she's also a student of the field that she is in, and she's currently working on her doctoral candidate. She's a doctoral candidate in public health, and she holds a Master of Healthcare Administration from the University of Missouri at Columbia, as well as a Bachelor of Arts degree in biology from the University of Missouri at Columbia. And I'm going to ask her about what made her get a degree in biology. I think that's a very interesting course study to go into. So I really want to talk about that as well. But I think it's so important to have someone like Cheryl on our show as we talk about so many issues that impact our community and how social determinants of health. We need to understand that more so that we know how do we go about really bringing equity to our communities. And healthcare is a major one. And not too long ago, if you follow us, we had a conversation around maternal health and the fact that Black women in the state of Texas die at more than 3 times the rate as their white counterparts. So we're conceiving, carrying children, giving birth to children, but Black women are dying at an alarming rate here in the state of Texas. So healthcare is so critical and important. So let's get started with questions. So Cheryl, welcome to our program. Let's welcome Cheryl to our program again. So thank you for being here. I'm super excited. Do you want to say hello to our audience before we jump into a series of questions that will have a robust conversation there around healthcare?
Yes. So thank you, Reverend Ayers. I'm very excited to be here to share my experience as an African-American health executive and what that really means and how I can help shape the care that our people receive. I think that's very important because most people are not aware of the disconnect of what happens from the executive side of healthcare to frontline actually receiving the care. So I'm very excited to be here. Thank you.
Good. So let's just jump right in with a little background first, right? So tell us what made you pursue this career path?
So this is going to sound a little cliche because everybody has a story, but this is my story of how I got into healthcare. When I was younger, my grandmother was sick and she ultimately died of colon cancer. And I was about 7 or 8, and I could not understand why the doctors couldn't fix her. So I determined at 8 I was going to become a doctor so no one would die of cancer. So that began my journey into kind of the healthcare field. So all through high school and even through college, undergrad, I was pre-med. So that's why I have a major in biology, because that's the thing most people do when you're going to go on to med school. And I love everything science. So I'm a little bit nerdy when it comes to that. When I think probably my junior year, I took the MCAT and did very well and could go anywhere I wanted to as far as med school was concerned. But something was just gnawing at me. I felt that as a physician, I would not be able to impact as many lives because I knew I did not want to do research. So I had an opportunity to talk with my counselor, and health administration actually then became an option for me because there are so many things that I'm able to do with a degree in health administration, from hospitals to outpatient care to long-term care, hospice care, insurance, healthcare plan. So that's really how I got into the field of health administration, because I felt like I could impact how care was being delivered to our community.
So that's really good. And it leads me to my next question is, so because what I'm hearing is you saying you felt it was very critical for you to take up space in that position to make sure, policy-wise, right, that things are being done that brought equity as it relates to healthcare. So talk to us about your leadership style and why is that important?
So I would categorize my leadership style as transformational and servant. So usually transformational leaders typically really try to create an environment that empowers individuals to work to their highest ability and teamwork, and to create this space for innovation, because the truth is the leaders don't have the answer. The answer is going to be within the team. Leadership will be a part of that, but truly the team and the front-facing staff really have a better feel for what's happening. So the transformational leadership style really helps to, individuals who have that really help to create that environment, to pull that out of individuals. And then from the servant, I feel like I'm just here to serve. I want to make sure that whomever I'm working with, because no one works for me, I work with everybody because everyone's role is important. I want to make sure that I'm in position to ensure that they have all the resources and support they need to work to their highest capacity, and also encourage them to progress in their professional career if that's something that they choose to do as well.
So let me ask you something about, because you are like a major leader in the healthcare industry, right? Particularly as it relates to systems. And we know oftentimes we talk about equity. It's really all about is the system designed and set up for everyone to flourish, right? So can you talk to us about how does a racial equity lens, how important is that to have in your leadership style? And do you see this across the board, not just your leadership style, right? Because there's so many healthcare systems, but can you talk to us a little bit about, is that important and why? And do we see that throughout the healthcare systems, or does that exist in pockets for people like you, maybe someone else who's more sensitive to seeing their role as beyond the building and the policies?
So that is a great question. I think it's important for people to understand what actually health equity means. We throw out a lot of terminology. We have, health equality, health equity, kind of what's the difference, and then why health equity is so important. So I'm just going to back up a little bit, if you don't mind. Health equality is about making sure people have access to the same thing. So if everyone needs access to an oncologist, we want to make sure that everyone can do that. That's all equality means. Now, health equity means we want to make sure people have access to the oncologist, but we may have, within that population, we may have individuals who have health insurance, people who are able to drive. Some people do not speak our language, so their needs are going to be different. So equity means really looking at individuals or populations of folks and making sure that we are meeting the specific need or needs that they have so they can access the care. So that's where you actually get equity. Just saying you can go to an oncologist, that doesn't mean anything, because if I can't afford them, I don't understand them, I cannot get there, it really, you don't take my insurance. I mean, if we have a chance to get back to the importance of President Obama being back, that's a good conversation there. So that's really what equity is really about. I think health systems are trying to get there, but the way that the system is set up, it's really set up to make money on people being sick. It's sick care. It's not a health care industry. So, albeit hospitals and huge health systems try to do that, we are really missing the boat. We have a lot of kind of trendy titles that are out there now around population health or health equity. And that's where you have individuals and teams that are really committed to looking at the statistics of the patients that they're seeing, identifying their needs, and then trying to determine what's the best network of systems within the four walls of the organization. That could be a hospital or it could be an outpatient facility. And the other services that are provided in the community, how do we integrate all of those services? So it's really more of a multidisciplinary approach to individuals receiving care. And that's really where you get to true equity. But even within that, you have to be very specific about how you are developing programs to meet the needs of subpopulations, if it's African Americans, or if you're doing it by age, or if it's by geographic location. There are just so many different things that you really have to be aware of to make sure that you can actually get to that equity standpoint from the healthcare.
Yeah, and I thank you for breaking that down, because I think you're right. We think equality is one thing, but equity is something totally different. And I know that's a big word. That's the catchphrase now in many municipalities, right? Even the city of Dallas, how they're going to have this citywide racial equity audit, which is going to hit healthcare, business, housing. It's going to hit all those major areas, which we'll get to in a moment as it relates to determinants of health. But I also think when we think about like you said, subset populations, African Americans, we still tend to be the population that's almost most impacted in a negative way as it relates to health. So, for example, when I talked in Fannie's class, just this idea of maternal health and reproductive rights, the ability of Black women to have agencies over their bodies. We have countless stories, right, of where they just do not receive the care, may have access, may have the money even, and still do. So I guess part of this is the implicit biases that may exist within healthcare systems. So I'm curious as to did any of that kind of work to maybe break those kind of barriers down, so that we are able to deal with inequity as specifically I'm talking about Black people and particularly Black women in this moment, of how our pain is not seen the same as other women, et cetera. And some of that has to do with who's caring for us when we go to these places. So I'm just wondering if you saw that in your work. Did you do things to dismantle maybe the implicit biases? Are there programs within healthcare systems that folks have to go through, healthcare professionals have to go to attend to that to make sure that that's not the case as women are looking for care, particularly Black women are looking for care?
Great question. So the answer to that is yes. There are things that can be done, and organizations are actually actively addressing kind of implicit bias. So when I was the chief operating officer at Prism Health North Texas, one of the things that we developed in working with the HR, the human resources team, was what type of training do the staff need, and to really help folks to understand biases in a way that folks are not offended to say that we all need to take this class. So that was the main thing. One, everyone is taking the class. Then two, we had kind of like group discussions around implicit biases to help people to understand what that really means, and that and unconscious bias, and that we all have it, and that it's okay. We just need to recognize if it is adversely impacting how we're interacting, with the patient or with each other, which then kind of determines how I'm able to provide service to a patient. So there are definitely courses and trainings that can be developed specifically for the organization, or, kind of like off the shelf if that's the route you want to go, to make sure. I think the other way that we get at bias in healthcare is we look at how individuals are trained. So when you're in medical school or nursing school, or if you're going to be a physical therapist, we need to be mindful about how we are training these professionals to interact with many different types of individuals, and that we all don't respond the same way. So we need to be more mindful of how we interact to make sure that people get the care that they need. For instance, with us, African Americans, just from the slavery days, good stock, they're robust, they can do anything. So they just assume that we're okay. And if we say we have pain, it's probably really not that bad, because, they can take it. So helping people just to be aware that even if it could be just an unconscious bias on their standpoint, not even realizing that's what they're thinking when I am talking to a person of color about their health care and whatever their kind of treatment plan is going to be. So education is one thing. I think the other way that we kind of get at this is to make sure that you have a diverse workforce that represents the community that you are serving. So I know I can speak from my own personal standpoint. When I look for any provider, medical, dental, vision, my first thing is I look for a provider of color, because my belief and my lived experience has been that they understand where I come from, and they listen. They listen to me. So I think those are ways in which organizations can work on bias, and that is a huge issue. Oh, and just one other thing around bias, research. So when we're even developing medications, we historically have not participated in a lot of research. So when research is done and a new therapy is identified, it's really based on the majority and not people of color. So we do not have good data on how our bodies respond, and the medications may work good in, Caucasians, but it doesn't work well for African Americans or, indigenous populations. So we need to be very aware of that as well, that we participate more in research. But we do have a history, as you stated earlier as to why we're a little bit more apprehensive to do that.
Yeah, and I think it's important that we break that, that we recover that, because that is a sacred memory for us to know what happened at Tuskegee. And I think it's also recovering Nurse Rivers, who gets a bad rap that this Black woman withheld treatment, but she did not know that's what the government was doing.
Yes.
Right. So it's for us not to definitely understand that happens, but to know when it's safe for us to enter into studies, and so we can research. So I think, and you touched on that, right? And I think this is why representation matters. That's why you have to have a diverse workforce, so that then you can be ambassadors to our communities, because you have to convince us to be a part of research.
Yes.
Who's getting my DNA? Who's collecting that sample? Where is it going to go next? These are legitimate questions that we ask, and we have a reason for asking them, right? So thank you for saying that, because we do need to be part of research, and we want things that are catered to fit our population, because we will respond differently, right, to certain medications just because of our genetic makeup. So thank you for that. So I want to turn to, because, as we talk about this, podcast is really designed also for us to be informed, that we can move into activism and advocacy. So public policy, as you know, is major when you're talking about how to bring equity, because it's all about how is the system structured. And so let's go back to President Obama returning to the White House to talk about that piece of legislation that was passed under his presidency. And so what does that mean as it relates to how public policies impact social determinants of health and health outcomes?
Okay, sure. So specifically with the Affordable Care Act, wonderful act, wonderful law, wonderful provision. So what's really interesting in the state of Texas, we have many providers who won't even accept the insurance. We have, I think the last time I checked, maybe 22, 23% of medical providers even accept Medicaid. So albeit we have this wonderful public policy in place, the system is still set up so that the individuals who are even eligible to receive ACA or Medicaid, they still cannot get care on a consistent basis or something that's close to them, because they're limited on the number of providers that are actually willing to see patients with that type of insurance. So that's one thing around public policy and access. And when you think about kind of the policy, one of the things that we need to be more inclusive. So when we put a policy in place, we need to be mindful of all those other things that impact one's ability to actually access health care. And I know you mentioned that we want to talk a little bit about the social determinants of health, but this is where there's a great intersection with public policy and the social determinants of health. In public health, there's this wave that's going on. It's happening in Europe, and it's happening in spots in the United States. I've not seen it anywhere where it has been adopted statewide, but some cities and counties have adopted this philosophy or this policy of health in all policy. So that means that when you create a policy and you are going to provide a new service, from the beginning, you think about all those feeders that impact an individual's ability to be able to be healthy. So for example, if we had a policy in Dallas that really addressed air pollution, and we would say that you could only emit so much of whatever the hazard is into the environment. What the health in all policy does from the public health standpoint is it looks at, one, where do you have the pockets of the hazardous material? What are the zoning policies in place that allow that to happen? It also looks at where are individuals, where do they live? What are the kind of the restrictions or guidelines in place around making sure that these housing complexes or even just, single family units are safe, and that They have walkable space, they have green space. So because you need those types of things for the air to be clean in order for individuals who suffer from asthma to be able to breathe more intently. Do you have a lot of bus traffic, just a lot of exhaust? You have major highways, running through neighborhoods. So when you look at public policy and how that impacts healthcare, you begin to look at, where do people live? How do they get to work? Are they able to work? Those types of things to really help make sure that the policy is very inclusive of those determinants that really set people up to have a better health outcome. Because when you look at how from the African American standpoint, we are usually the population that fares the worst in almost every category of all chronic diseases, life expectancy, the whole 9 yards. So more of us are poor. More of us live in very densely populated areas that are very polluted because of zoning, or just, our cars are not as new, so we have the ones that, emit all of the exhaust. We're living in very crowded areas. People smoke. We also are living in areas where we have food apartheid. We can't get to very good, fresh vegetables. We don't have any green space. We're living under stress just because of what we look like. So if we are not, when we're developing policies that are supposed to positively impact health outcomes, these are the other things that we have to look at. And that's the challenge for healthcare, because again, for people to be sick, for people to be well, their environment has to be safe. And that is where we have to spend more of our time, I believe, to make sure that we're working with those partners from the policy standpoint, and then just whatever services that are being provided in the community to kind of wrap around our community to make sure that we have access to the resources we need to make better decisions and have better health outcomes.
Yeah, and I think what you're saying is so critical. And I think just for everyday people who may be watching, they don't know much about healthcare or what a social determinant of health is, just at the basic level. But the way in which you just explained, I think helps people to know everything every part of a justice movement, whether it's economic justice movements, whether it's environmental justice movement, whether it's food justice movements, you're saying all of that is so critical to our well-being.
Yes.
Our total and well-being. And so we ask people, join us down in Shingle Mount to remove the toxic waste. Like, we're asking you to do this because this impacts our ability to be healthy. Yes. Because if my health is not well, I can't go to work. I can't get money to pay my bills. Then do I get evicted from my home or my apartment? Like, all of this, really connects. So let's take a step back, because I did jump into that question. Just a very low level way of explaining it, just elementary way of explaining it. What are social determinants of health, and why should we care about those?
So again, social determinants of health are those other factors in life that impact your ability to be healthy. And so education is one. Typically, studies have shown if you're not as well educated, your health outcomes are going to be worse. So if we are not, we African Americans, I'm going to focus on us.
Yes, please.
If we are not able to go to schools that are well funded with diverse teachers and a commitment to making sure that the student can actually get there and that they have the support they need. That could be either tutors or, now in the world of COVID, we all need to be connected. So if if we need to make sure that the internet, that whole system is working well, so they can do their work. Do they even have a computer? So if the educational system is not set up well for a young African American child to thrive, then he or she will then have a hard time making it to the next kind of determinant of health, which is employment. So if I'm not educated, what's the likelihood I'm going to get a job that really allows me to live the best life that I can live. I want to have my family in a home that's safe. People have their own rooms. The water is clean. The neighborhood is safe. So education, employment, those are, and employment becomes income. With income, you also have access to, do I have insurance? And do I have insurance that I can actually afford? So those are the types of things that when we talk about the determinants of health, that and there are many more, but those are just kind of like the basics. So, and we struggle at the very basics. Education, employment, housing, just transportation. Our people struggle with all those things. And that compounds the stress that we have, which then makes our health conditions that much more difficult to manage, because every day we have to make choices. Do I eat? Right. Do I pay a bill?
That's right.
Can I get to work? Who's going to watch my children? Oh, I have to leave them at home by themselves. Will I get in trouble for that? What's going on in my community? Is it safe? So those are kind of when we talk about determinants of health, that's what that means.
Yeah, and to your point, there are so many. I know healthcare has like a set number, like 7 or 8. But to your point, which is why I think it's so important for us to have this conversation, so we can understand that when we are not well, it's not just about eating better.
Correct.
Right? Because even if I can eat better, but yet I don't have employment, I don't know how, you need it all works together. The intersection, right?
Yes.
The intersectionality is so critical and important to understand that. And that's why I tell people, find a movement to get involved in. Whatever that justice, you're doing your part in this circular, if you want to look at that way, of social determinants of health. They're all connected.
Yes.
It's all interconnected. You can't do one without the other. So I think that's why this conversation is so important, because when we think about health, I always think about it as well-being. What does it mean to be well? Wellness, right? It's not just taking medication and I feel good, right? But it's really seeing it as its more broader sense of what it means to be well. So the next thing I want to ask you about as we talk about that is going to be, what are some of the major health disparities, because we're talking about Black folks right now, some of the major health disparities that you are aware of, if you were to say, oh, we should go out and really organize and mobilize around this? Now, I know we have many, but what would be like maybe the top 3 you would say we really need to give our attention to?
I would say my first one would be around asthma. Our children are 4 to 5 times more likely to have asthma. They have serious exacerbations, probably 3 times or 4 times higher than other populations. And our children are, I believe the statistics is almost 8 times more likely to die from asthma. So that is one. And when you look at asthma, there are a lot of things that impact asthma. So one, obviously the environment, kind of what's going on as far as having clean air externally and also internally. You have pests, you have dust mites, you have people that smoke, you have people who may have alternative forms of heating their homes, which is not clean. And then you have what's going on outside. Are you living in an area where you have airplanes going around, or a lot of, trucks, or just cars and lots of intersections? So I think that's one major disparity. Obviously, all the cancers. I mean, but that's really big. And I think the other ones that I would look at would be diabetes and high blood pressure and cardiovascular disease. I see it's just so many. But I struggle with that because there's we have these comorbidities, and they're all just kind of like stacked. And whatever your diagnosis is, when you look at the environment in which that individual is living, then you'll understand kind of why. So getting back to your point around how can you get involved, from the justice standpoint, there's just so much that can happen around food and environmental justice that could have a
Without question.
tremendous impact on the health in the community for folks.
And I'm not the expert you are, but I'm gonna throw another one in there.
Okay, I'll do my best to answer.
That we are really trying to work around even here, and that's around reproductive justice and specifically maternal health care. And the fact that Black women are dying, and what does that mean for our future, right? Because there's a major disparity in the healthcare system. And that's the question, right? Why are we not surviving the moment? And I think that's worth looking into, and that's worth doing our own research. As you know, we are working with the AFIA Center, who's trying to do that, at least a local level research around that, and the policies and the laws that are hopefully come back around the next legislative session that we can, get behind and be a part of making sure we have a policy in place that specifically, to your point, that sometimes we have to have policies that specifically address that part of that group in our society, this case, Black women who died disproportionately.
Yes.
And that's not to say that we don't care about other women who are not surviving the moment, but when you have a group that's 11% of live births, but 31% of maternal mortality rate,
Yes.
that's a state of emergency,
Yes.
and it's a deafening silence there. So I'm just throwing that one out as another major health disparity, because that's increasingly becoming something that every time I'm reading something, it pops up everywhere I'm looking now. I keep finding this information. So I think that's something that's so critical for that. So let's go to one more question before we wrap up your official interview. Or let me do it this way. What would you want us to know about the healthcare system, and or what you think are the major challenges that the healthcare system faces?
Major challenges. I still think healthcare is difficult to navigate. And as a healthcare professional for almost 30 years, I can say that I have challenges navigating at time. And I consider myself to be highly informed and educated. So that says a lot for people who may not have as much education as I have, or as many resources, and them trying to figure out how to access the healthcare. So I think that's one of the major challenges, is that just that navigation is very challenging because of access, lack of insurance coverage. And then I think the other challenge around that is we don't have enough diversity. We don't have enough diversity in the providers. We don't have enough diversity around executive leadership. Middle management is a lot better. And of course, frontline staff,
Right.
we got that covered. But unfortunately, the way that the system is set up, frontline staff are not in the position to be able to make decisions.
Right.
So that's why it's very important that at all the other levels, there's accurate or reflective representation to ensure that these crucial conversations are had, and programs and services are developed to make sure they address the population. Other challenges from healthcare, I think that it's still just too complicated. We haven't figured out how to converse with people in a way that they feel comfortable and they can understand. And again, that gets back to cultural competency, right, and just really kind of creating a space and receiving and accepting people for who they are and where they are at. We have to go beyond the four walls of the health systems, the hospitals, because again, to get to well-being, to make sure people are whole, we have to do the work, not only with what's happening inside, but out in the community as well. And how do we make those connections? We fight over the money,
Right.
We have to figure out how we definitely need to keep the doors open. So I'm not going to say that, you have to have the doors open, but I do believe there are better ways for integration within the community to make sure that individuals are receiving the care that they need. And I can't remember the second question that you asked me.
No, that really kind
Okay,
of
great.
that kind of wraps it up there. So I think for this part of our interview, the very technical, the very informative part of it, because part of Fannie's classroom is obviously how do we talk about issues that impact us every day, and then what we can do to feel empowered to get engaged and involved. Because sometimes, first, yes, liberation starts in your individual mind, and then it should have some type of outer, manifestation. But I think it starts in our mind, but it's also, some people are just like, well, where can I jump in? I think you've given a lot of ways in which we can find our place in this movement, whether we want to deal with, food apartheid, whether we want to deal with food justice, or do we want to talk about these environmental hazards that are in our neighborhoods, and how do we get involved with zoning at the local level? So you've laid out so many ways that people can be engaged, and expanded perhaps some of our knowledge of when we think about healthcare systems, that is so much more than just going to the doctor, right? That us to be made well has everything to do with how we take the things we can take charge of. Like, do those things while we continue to work with, to really, I say, dismantle, to tear down and build back up something that's more just and equitable, right? And that takes folks, to your point, being on the inside and being at those decision-making levels. So so I want to wrap this part up of the interview up. So let's just go ahead and thank Cheryl for this amazing, informative conversation around healthcare systems and how we can be engaged. So one of the things we like to do here in Fannie's Classroom, because everybody has their vocation, they know their stuff, they're on it, we get informed, but then we want to know, you're more just, you're three-dimensional. You're not a one-dimensional woman, right? You have so much more to you than your executive leadership and all that you have done. So we like this part of having just a parlor conversation like they did back in the day, where we just sit in the sitting room and talk about all things. So this is more relaxed. It's not so structured, so you can relax now. So first, start off by tell us one thing about yourself that we're not aware, that most people aren't aware of.
Let's see. Good question. I would say most people that don't know me. So my mother is a twin. I am a twin, and I have twins. So that's something that most people don't know about.
Right?
Yes.
Okay. So one of the things I read in your bio is that among the many things that you do, that you work with providing strategic and operational consulting services for local nonprofits that address determinants of health by focusing on social justice and race equity issues. So tell us, where are one of the places that you do this work?
So I have the great fortune of doing some consulting work with Friendship West and their Justice Department. This has been probably one of the most gratifying opportunities that I've ever had in my life. I started out as just a volunteer, a ministry partner, and Reverend Ayers saw something in me and how I could bring my talents to the department. But it's really been a pleasure to help do a couple of things. One, you've done a lot of great work with the Justice Ministry, and the infrastructure that's required to keep it moving is immense. So having the ability to really kind of formalize that foundation through developing a ministry partner manual, also helping to put in more protocols to help our teams really kind of focus on the key issues as identified by the church, and using SMART goals and metrics to make sure that we have the input that we need in the community, and also just developing new ways in which to kind of reach out. I've learned a lot from the whole kind of digital asset standpoint. I've never done that type of work before, but that's been fun. But I really enjoy developing kind of the infrastructure and kind of the planning process for, what does it really take to get these initiatives off the ground, and what's the best way to utilize the skills and talents of the individuals that have volunteered to be ministry partners.
Right. And so, audience, don't forget, you have any questions for Cheryl, drop them in the chat. We'll make sure we get to those. But here's one of the things we always like to joke with Cheryl about around here, because you can see she's very clearly very well educated. She has a posture of, very professionalism, but she does not like to look in the camera, be on camera, or take pictures. So part of what you've had to adjust to is really come out of your shell a bit, right?
Yes.
So talk to us about some of the things you've had to do here that have made you have to broaden and expand and really grow your portfolio.
That caught me off guard. I wasn't ready for that one. So I will get back to I don't mind talking to folks. That's something I love to do. But again, if I have to be a part of a video, I'm not really excited about that. So a case in point, we had a chance the church did a great trip to the border to help our Haitians brothers and sisters, and there were lots of opportunities to interact and support their needs by providing mats and school supplies. But a part of that, you have to do quite a bit of what do you call it? Kind of, it's not PR, but you have to do like photo ops and taking photos and things of that nature. Was not very excited about that. I think I've been a part of a couple of videos that I don't think I've seen the final version because I'm in them, but I have participated. So I think that has allowed me to grow. And I think just understanding and learning how the church operates, how it functions. And these are my terms, not the church's terms. But, from the business, I look at it from the business perspective, and it's just really interesting to see how the ministry is developed and then kind of just poured out into the community. I think that has been something that I've learned, especially from you, from the justice standpoint, and then just seeing Dr. Haynes. I mean, and Wednesday nights, church is a business, but it's a beautiful business that has the ultimate mission. So I think that I have really learned a lot, and I think that will help me in whatever my next chapter will be, because the focus on humanity, God, it never ceases. And I think the other thing, that even though I am African American, I think I am more Black now than I have ever been in my life. I don't know if that makes any sense, but just Friendship West, just the church, you all just love us, and you are in it for us, and you will do what is necessary to stand up for us and to help put things into motion so that our people can be successful. So I think that's what I've learned and how I've gotten a little out of my comfort zone.
Yeah, and thank you for sharing that. I didn't know all that. So good. You just work with folks, and you just for me, my personal leadership style. I'm very much a decentralized type of person. I think we can work in a very circular way, but with structure and some form of accountability, obviously. But I think you're an example of what it means for whoever you are, wherever you are. Whatever gift or talent you have, whatever your vocation, there's always a place for you in a church that does not separate the body from the soul, right? That we care about preaching on Sunday mornings, but that's to get us ready to go out and deal with all that we are dealing with between Sundays, to use the language of Dr. Marla Frederick. And so I think that's a classic example. And I think you really laid it out well. And I'm hoping people can see the connection of what you do professionally and how that's been able to impact the church, the local church, right? Yes. Because you have come in to help formalize a lot of the processes and procedures in the Justice Department that we did, but it wasn't really written. And it kind of gets us on a level of understanding where we're going, how we're going to get there. And it begins to create institutional memory. So, when I leave this place, the next person come in and build on that and not start from scratch. So I'm hoping what people also hear and see in this moment is that it doesn't matter whatever your vocation is, local congregations can use your expertise and your skill sets that you have to marry with the church's ministry and vision. So it's been a pleasure having you as part of our justice team before you came on as a consultant, right? You were already doing quite a bit of work with the ministry. And I want to say I met you the first time when we did, because also, we try to get outside the church and allow different learning opportunities, because I believe in creating a dynamic learning community that can look many different ways. Family's Classroom, we hope, will be another asset to that. But we did a trip to Alabama.
Yes.
So tell us a little bit about, I don't know, that was your kind of entry point to get started with the church or not, but tell me a little bit about that.
So I've been a member of the church since 2006, but I've never been active. So doing that Alabama trip, I think it was highly emotional, and to see the time and the effort that was put into all of our activities, if it was to visit these historic sites, or if you were doing a ritual to get our day started, everything just was really kind of rooted in our ancestors and in God. And I think that really kind of sparked me to join the ministry, because I did not want to do healthcare, because that's what I do, so I wanted to be able to take the skills that I have from my profession and take that to another ministry. So that is when I joined the Justice Ministry. Was I asked about it while we were on the trip, and Reverend Durr said, "Oh, let me introduce you to Pastor Ayers," and that's when I think we talked just for a little bit, and you were like, "Yeah, we meet." It was just kind of real quick,
right?
The basics, but then I followed up when I returned, and I've never looked back. It's just been an amazing gift to be a part of this ministry.
Yes, and you've been a blessing to us as well. So I think one final question I want to throw out there to you is, who are the 3 people who have been most influential to you in your life?
Oh my goodness. I try to get through this without shedding a tear. So I would say, obviously, Jesus Christ is just, so I don't know if that really counts, but that's the ultimate. But I would say probably person-wise, my first one would probably be my mother, single mom. We grew up on public assistance, and she was able to keep it together for 5 children, all educated to various degrees, no real problems, whatever. We're all good. So I think that just seeing her be successful as a mother and all the challenges that she had being single. My grandfather, my mom's father, he was just amazing. When we were little, we were scared of him. Everyone called him Mr. Mose. We called him Grandpa. And he always made us get up in the summertime, and we had to do chores in the morning. We had to go weed the garden, or, shuck some corn, or we were doing something, know. But I think he taught me a work ethic that you give your best, and you should be honest at all the time. And my mother was more of the kind of the nurturing. It's important to take care of people, especially when you have the ability to do that. And then probably third, I would say there's a few, I think, teachers that I had along the way who acknowledged my potential and always encouraged me along the way. And I think that helped create the space for me to be successful academically and then also professionally. So,
well, I can say this because I've worked with you long enough. Your mother, your grandfather, those teachers can be very proud because all they poured into you, we see that manifested. I see it every day in the work we do. You have a great work ethic, right? You're an honest person. You're a very direct person. You're nurturing too, right? And so I think those lessons have certainly not gone to waste. You do it well, so they can be very proud of you, as well as your other ancestors as well, right? Just in terms of what was important to you, what you have inherited, because oftentimes we think inheritance is the money. But even Mary Blige Bethune let us know her last will and testament was she left us faith, love, and many other things that you need to make it in the world, right? But money ain't bad. Now we do like to have that, but it's not the center, right? So I think they can be very proud of you. So they've done a great job pouring into you. So can we give a final thank you to Cheryl Prelow, who joined us on today's episode of Fannie Lou's Classroom. And listen, don't forget, we're here every Thursday, 12 o'clock noon. We'll see you next week.
From the church house to the